All right.
Good morning. I'm Dina.
I'm Lisa.
We're speech pathologists at CMH, and we're here to talk about aphasia after a stroke. June is Aphasia Month, Aphasia Awareness Month, and we're here to tell you about the language disorder that's called aphasia that you may experience after a stroke. So in the year 2016, 5 million people were stroke survivors, and of that 5 million, one-third of those survivors experienced aphasia, and 84.5% of those survivors had never even heard of aphasia. So let's discuss, what is aphasia? Aphasia is a neurological disorder that affects the ability to understand and use language. You may have problems speaking with other people or asking for help, understanding what others are saying to you, following directions given to you, or difficulty with even reading and writing. The causes of aphasia result from a stroke or a head injury or any other trauma caused to a specific area in your brain. Based upon what area the stroke occurs or the trauma occurs, that's going to tell us what kind of deficits that you'll have. Aphasia affects 1 million Americans, or 1 in 275 people. That's more than 100,000 Americans that acquire this disorder each year. So let's talk about the areas of the brain and what the areas are responsible for and what deficits you may find based on the injury. So on your left side of your brain, that affects all of your right side of your body. And it could be responsible for trouble producing spoken or written language, which is called expressive aphasia. This occurs in the Broca's area of your brain. It affects the ability to express yourself with language. And then on another area is called Wernicke's area. That affects trouble understanding language that's being spoken to you. So expressive aphasia is difficulty expressing language, and receptive aphasia is difficulty understanding language being spoken to you. With this, you might have slow, careful movements. You might not be able to see things on the right side of your body, and you might have facial weakness or a droop, which will give you some uncleared speech and some difficulty swallowing. As speech pathologists, we treat both language and swallowing and cognition, so we're gonna just focus on the language part in this broadcast today. So let's talk about what happens if the stroke occurs on the right side of your body, or right side of your brain. That affects the left side of your body, and it could be responsible for trouble knowing how far or near an object is to you. You might neglect the whole left side of your body and just not even realize it's there. You might not be able to see things to the left of your body either. So in an environment, you might not be able to see your dog is on the floor or other things to the left, which pose some danger and hazard risk to you. You also notice that these people might have a little bit of poor decision making. They might be impulsive, and they might have lack of insight to these changes, so they really don't even notice anything's different about them. And again, you'll see the facial weakness, a little bit of a droop, slurred speech, and problems with swallowing.
So I'm going to address what type of impairments we may see depending on the location of the stroke. So I have just a little illustration of the brain here. So we have the frontal lobe, we have the temporal lobe, the parietal lobe, and the occipital lobe. So the frontal lobe is kind of like our command center. It's responsible for executive function, making our decisions, what we're going to do, our emotional regulation, our behavior, our personality. So when people have a lesion or a stroke in that area, they may exhibit poor judgment, poor problem solving. They may get angry easier. They may start having a lot of lability, crying, or upset. It also affects our speech and writing. So Dina had referred to the Broca's area, where you may have problems with motor programming for speech and writing. The parietal lobe interprets language and words. It also interprets our sensation. signals from vision, hearing, motor, sensory, and memory. So on the left lobe, you may experience deficits in word retrieval, whereas a lesion on the right side, you may have difficulty in interpreting sensory information coming for vision and things like that. Occipital lobe interprets all your vision, color, light, movement. People that have injury to that area, they may experience visual field cut. So they'll have a portion of their vision is actually cut, and they have no vision in one area. So either on one side of their eyes, or in a corner of the eye where they can't see. And then in the temporal lobe, that is where the Wernicke's area is, and that goes to us our understanding of language. So somebody that has a stroke in the temporal lobe may have have difficulty understanding language, following directions, but they also have poor awareness and difficulty monitoring their own language. So their speech may be really fluent, but it may not make sense. They may string together words that do not form a cohesive sentence, and they don't have the ability to monitor that. It also causes impairment in memory, hearing, and sequencing.
So what do we do about this? What happens is after the patient comes to the hospital, the doctor will order imaging by brain CT or head CT, brain MRI, and then they will refer to a speech pathologist. And we will come in and we will administer a formal as well as an informal assessment. Some of the assessments are called the Western Aphasia Battery or the Boston Diagnostic Aphasia Examination. We'll perform those to see what deficits you might have that we listed based upon the lesion of the brain. And once we evaluate, then we start the treatment process, and treatment starts in-house in the hospital, and we will work on communication strategies, word finding strategies, memory strategies, caregiver education, communication strategies, how to best communicate and understand your loved one when they have a communication impairment. From there, once you get discharged from the hospital, we're going to recommend that you continue speech therapy. The best recovery occurs, usually they say within the first month after a stroke, but there can be ongoing recovery for up to years after. So treatment is usually indicated for 2 to 3 times a week, and in the treatment we'll, like I said, work on those strategies at another facility, like usually an acute rehab or a skilled nursing facility if you go there. And if you don't go there and you go home, then you can have speech therapy at the house, or you can come here to CMH in Ventura and receive speech therapy here. We have speech therapy 3 to 4 times a week, and we encourage you to come with a family member or caregiver so we can foster that communication between you when you're not here, and improve your quality of life and ability to make your needs known and be understood outside of the therapy room. Many people will experience dysphagia, which is difficulty swallowing, and we'll save that topic for another live presentation, but speech pathologists are the ones that work on that as well, and we can do that at the same time as your speech aphasia therapy as well.
Right. So, as Dina had mentioned, one of the important components of our therapy includes educating family and friends on how to communicate with their loved one who's had a stroke. I think that all of us can relate to having, someone that we know, either someone in our someone in our family or a friend who's had a stroke. So Dina had talked about the right brain, the deficits that can occur when you have a stroke in the right hemisphere of your brain. And some of these deficits may be somewhat difficult to notice at first. It could include poor attention, decreased perception or awareness, ability to process information, both visual and verbal, decreased cognitive skills, so they may have slow thought process, exhibit poor judgment, such as reaching for a hot pan on the stove and not really thinking through before they make a decision, more impulsive. So there are some things that caregivers can do in order to support their family members and help keep them safe. One is to really look around the environment and make sure that dangerous things are out of the way. And also to make sure that the environment is clutter-free. Sometimes there may be a visual neglect where patients are not looking, family members are not looking around their environment to make sure that it's safe to walk. So if there are things on the floor or things that they can bump into, that might cause an injury. The other one is making sure, so that you have to make sure that they scan the entire environment. Be sensitive to their needs, and just try to be understanding that these things, that they may take some time to process information or to make safe decisions. A patient who has had communication issues, such as aphasia, we would encourage patients as well. Sometimes their ability to speak and communicate and to understand is variable from day to day. So it really could depend on if they're tired, if they have a headache, if they're having a rough day. So how many distractions or stimuli is in the environment? Are you guys in a noisy store versus being at home by yourself? Eliminating distractions when you're attempting to communicate is really important. Some of our patients may have auditory discrimination difficulties, so they have a really hard time being able to discriminate between the environmental sound and what you're saying. Keeping your questions very, very simple and not bombarding someone with one question after another. Sometimes it's helpful to support the question with a visual model. So, do you want orange juice or milk? And having those two things where if they cannot verbally communicate what they want, they can point or make a choice. When you're giving directions, making sure you point to different things, and keeping those directions very, very simple. Speaking in a normal voice, not shouting, unless they do have hearing loss, and then allowing time for them to process the information that you're giving them, and then also giving them time to respond as well.
And one last thing I'd like to mention, there's a book that I just love to recommend to patients' family members or their caregivers, and eventually the patient themselves to read. There's a book called My Stroke of Insight, and it's written by a neuroscientist who knows all about strokes. She studies them day and night, and she actually suffers one herself. And she writes a memoir of what her experience was like while having the stroke and what the recovery was like. And then she wrote this book. And in the book, I just remember so vividly how she describes the level of fatigue she has from just relearning to do a puzzle or communicate with someone. So it's really, really important to be patient and expect fatigue, to allow your brain to really recover. Because if you think about it, after you have this stroke, it's like all the words in your brain were filed in folders in a big filing cabinet, and now it's dumped out, and we have to put everything back in its place for organization and retrieval to use those words when we need them. It's very exhausting on the brain. All that tissue is recovering, and it needs a lot of rest just as much as it needs to work on recovery. So just remember that it is challenging, provide breaks, be patient, but there's a lot to be recovered with the right type of therapy.
We want to thank you for joining us today. And if you have any questions, you can certainly post them here. Our department is also available if you for rehabilitation services, physical therapy, occupational therapy, and speech therapy following a stroke. Please reach out to us. We are here to help you.
Thank you.
Thank you.